The symptoms of listeriosis can vary depending on the person who gets the disease. The majority of people who do not have a high risk of having a bad case of listeriosis will manifest with fevers, aching, and some gastrointestinal symptoms, nausea, sometimes vomiting, and diarrhea in some cases, because that's the way we get infections with Listeria. This is an infection that is transmitted by usually contaminated products. So the manifestations in normal cases are more gastrointestinal. However, this infection affects mostly people who have a bad immune system, or newborns or pregnant women, and the symptoms might be more severe in first place, and two, depending on the kind of infection that listeriosis, that the listeria organism might be causing, it can cause some other symptoms. And for example, one of the considerations we have with listeriosis is that it can cause meningitis in special situations. So the symptoms will be like having meningitis. So patients might have fevers, chills, stiff neck, problems with the light bothering them, and some people might develop mental status change. So it depends of the kind of severity of the infection that we're dealing with. If you think that you might have listeriosis, you need to seek medical attention. This is a bacterial infection, so there are antibiotics that we can use to treat this infection. And as I said, depending on the severity, it might be a very serious situation in some cases. So, for example, pregnant women again, or patients who have problems with their immune systems, and if that they develop symptoms that might be related to listeriosis, then they need to seek attention right away, because they need antibiotic treatment. We are still in the process of knowing how the outbreak is developing. What we know is there's just one farm that is involved in this outbreak. It's a farm in Colorado. And the important data that you need to know is, if you are planning to buy cantaloupes in your grocery stores, to know where they're coming from. And usually the stores are pretty good in knowing where they're getting the suppliers, and I'm sure a lot of people have asked them by that by now. So that decreases obviously the chances of having the exposure to it. But the problem with this outbreak, I believe, is the fact that the incubation period of this organism, it can be very long, and these organisms like to live in at lower temperatures, and and that just goes uh, a little bit against to the usual recommendations on how to handle food. We think that placing or food in a refrigerator might decrease the chances of having infections, and the majority of cases that's still valid. But unfortunately, this bacterium thrives on cold environments. So, for example, dairy products, which were usually or classically associated with these infections, um, were were one of the risk factors for this infection. But at this point, we can probably see some other cases even after the recall of the cantaloupes, and so some people might still showing up some symptoms even after all the awareness that we're having about this outbreak. So if you still have some symptoms, and if you're still concerned that you might have been exposed, it's still valid to seek medical attention.
You know.
No, I don't have any information. As I was saying before, I have bought some cantaloupes recently, less than 3 days ago. They had a seal of the place where they came from, I guess, and they was not from this farm in Colorado. So I guess I felt safe. And so far I haven't had any symptoms. And but again, if you have any doubts, then you can ask. I'm sure you can ask the grocery store. And if you're not able to identify the source of the cantaloupes, then I think it will be better to dispose of them. And even if you have something at home that you bought before, then if you're not sure where is it coming from, then the recommendation will be to dispose that as well. It can take some time. The time is based on the fact that the bacteria needs to multiply before it's able to cause some symptoms. You know, some gastrointestinal infections might be faster just because instead of being the bacteria multiplying, these bacteria sometimes have some toxins, but that's not the case with listeriosis. Listeriosis requires some multiplication and some other processes before you're having some symptoms. So it's not an immediate reaction. It can be probably 24, 48 hours. But again, it depends on what it depends on the immune system and depending on the situation. So, for example, the pregnant woman who has listeriosis and is in the process of giving birth can pass this infection to the newborn pretty fast, and then the babies can get pretty sick in the first 24 hours after being delivered. So it just depends on the situation and the kind of patient we're talking about. The precautions are pretty similar to when you buy fruits. Ideally, you need to wash them and peel them, and that I think still holds true for a lot of other things that we buy. For cantaloupe, it might be a little bit more dicey, just because it's kind of difficult to really wash the surface of a cantaloupe. It's very rough and it has those crevices, and sometimes it's difficult to do that. The second thing is that usually you peel the cantaloupe and you can say, well, it's soft, so it shouldn't be a problem. Well, that might not be necessarily true. If this bacterium is in the surface and if you haven't been able to clear that out completely, there is a chance that the bacteria might be passing through that knife and then getting inside the cantaloupe. So again, the important thing is that you know exactly where this cantaloupe is coming from. That's probably the best defense in all this. Um, if he ate cantaloupe a month ago and you don't have any idea where this came from, I don't think I'll be extremely worried about. I think it's too far for that to be causing symptoms in general. But if you notice still some problems like fevers or chills or muscle pains or diarrhea, and then you can talk about that with your primary care provider and get checked whether listeria might be one problem. But I think this will be somewhat unlikely. But if you still have some concerns, don't hesitate to ask that to your primary care provider. Listeria can be isolated in different cultures and some other samples. So if there is still some concerns, that can be worked out.